Hey guys, I'm Dr. Lindsay, and today I'm going to show you how to give an intramuscular injection. And this can be applied to dogs and cats. Today I'm here with my tiny actor, and his name is Todd. And I got Todd when I was in 9th grade. So Todd is going on to be 16 years old. We might have a little sweet 16 party for him because he is pretty ancient. He's very delicate. You look at him, he is an old chihuahua. So you guys might have an old pet out there and you might be able to relate with me that these dogs get very decrepit and they get arthritis. So today I'm using him to show you how we give his IM injections of joint supplements to help lubricate his joints and make him feel comfortable. In this video, I'm also gonna go grab one of my friend's pit bulls to show you how to give a large breed dog an IM injection. And then I'm also gonna sneak in a cat and give them an IM injection. So giving intramuscular injections, you might need someone to help you. So I'm gonna get a technician to help hold the dogs for me so that we can safely and smoothly give them their intramuscular injection. So there are 3 ways you can give an injection to a dog. The first way is called subcutaneous injections, which are underneath the skin, and that goes right in the fat layer. The second way is intramuscular injections, which I'm gonna show you guys how to do today, which goes directly into a muscle. And then the third way is an intravenous injection, which goes into a vein, straight to the bloodstream. So today I'm gonna focus on the intramuscular injections, and the muscle has a lot of blood vessels in it that will carry away the drug that's administered to the dog. We give animals intramuscular injections because of the high concentration of blood vessels in the muscle to quickly transport the drug throughout the body. Let's get straight to the point of showing you guys how to give an IM injection. So you're gonna need a needle to start. If you're scared of needles, you probably won't be giving an IM injection, and you will take your dog to the vet, and the technicians or the veterinarian will give your dog that injection. So there are different needle sizes. This is a smaller needle. This is a 25 gauge with the blue cap. Here's another 25 gauge. And then we have a 22 gauge gray top one here. So you can have bigger needles or smaller needles. I like using the smallest needle that we have to give them their injections because it's less painful for them to have a tiny needle poke them. So let me open up this syringe, and then I will open a brand new bottle of Summit, which is a chondroitin sulfate. I like to tighten up the needle by just holding it on and screwing the syringe tight onto it so that it has a good suction when you're drawing up your product. So Todd is a tiny little chihuahua. He's gonna get a small amount of product. So you just take off your needle cap and then you inject it into here, and you will suction back the dose for your dog. So this is a thick, kind of lubricating substance. So it's gonna take a while to draw up the amount you need. It'll come in like drop by drop. So Todd just gets 0.2, so he gets a low amount. And then you just take it out like that. Let's pause for one more second and let me tell you where you can give an intramuscular injection. So anywhere there's muscle, obviously you can give an IM injection. Todd is super old and has muscle wasting, so injecting into these deltoid muscles, I have the chance of hitting his bone here, which is crunchy and it's gross and it can be painful. So I don't really give him the shot in the shoulder. And also for the leg, he has muscle wasting, and there's his hip bone right here, his femur right there that I can feel. So aiming at these quadreceps muscles and the gluteal muscles is difficult, and you could crunch some bone there. So I don't like using that spot. I love using the lumbar muscles because there's a cushy pad here, which is all the muscle along the spine. So you just go to the spine and you palpate the spine with your fingers, and then you go right next to it about 2 finger widths, And then in the middle of your 2 fingers right there, you'll give that IM injection, and you're gonna avoid crunching or hitting any bone. So that is why I like the lumbar area the best to give an IM injection. So when you put the needle into the dog's muscle, you wanna have a 90-degree angle or a slight 45-degree angle. I like the 90-degree angle because it's straight up and down, goes straight into the muscle, and then I pull the needle straight out. So I just go half of this metal needle in. I don't go all the way in. So that is one thing I want you guys to know, is you don't have to push this all the way down into the muscle. Just go halfway. So I measured, there's the spine, 2 fingertips over. I go in the middle of my 2 fingers. So I'm gonna inject right there. Well, I'm gonna hold on to him up here, okay? I'm gonna give him the shot, inject it and out. All right, so you gotta kind of do it fast, and this is the reason a lot of people go to their veterinarians, because it's hard to do this by yourself. So that was a real live example of giving Todd an intramuscular injection by myself. It's okay, Todd, you're a good boy. You're a good boy, you get lots of treats after this. Lots of treats for an old man. Okay, so I'm gonna go put Todd back, and I'm gonna go grab a big pit bull and have a technician help me give her an intramuscular injection in the lumbar region. She's actually a very strong pit bull, so I could use a gluteal muscle for you guys. So let's just see what I decide to do. Let me go run him back to his little kennel. All right, so I just drew up the product, but to do that I had to stab through this rubber area of the vial, and that dulls my needle. So what I like to do is switch out the needle to a new one that has never been through a rubber top. So it's fresh and very sharp and less painful when you give the injection. So my lovely technician, Kristen, brought me Nuni, who is a pit bull, to give her summit chondroitin injection for her arthritis. So because she's a bigger dog, I'm gonna have Kristen hold her for me so I can quickly give her intramuscular injection. So just looking at Nuni's body type, and she is of course a lot younger dog than ancient Todd, she has a lot of muscle. So she has good muscle on her deltoid area, she has great muscles on her lumbar region, and then she also has good muscle on her gluteal region and her quadreceps muscles. So I'm still gonna choose to do the lumbar region because, like I said, that's my favorite spot to give it. So I go down her spine with my fingers, I palpate her spine, and then from there I go 2 finger widths over, go right in the middle of those 2 fingers on that squishy muscle there that you can palpate. All right guys, so you have to be firm and fast with this because dogs don't like getting poked with a needle. Right when they feel it, they're gonna try to get away from it. So palpate, eyeball where you're gonna go, I hold on her shoulder or I'll push her against Kristen, do it fast and inject and then pull out. She cried, it's over, good girl. And this is the exact reason, again, most of you will go to your veterinarian to have an IM injection done, but that is what it looks like. All right guys, so we have our little kitty cat here named Luna, and she's a rescue. She was found on the side of the road after she got hit by a car. So she has some hip arthritis, and she benefits from getting the summit injection of that chondroitin sulfate to help lubricate her joints so that she heals better. And Kristen's gonna hold her again for me so I can show you guys how I give her an intramuscular injection. All right, so this kitty cat's gonna get 0.2 also. So I'm gonna have Kristen put the cat on the table. Okay guys, so Kristen is scruffing the cat because that is the most secure way to hold a cat when you give an IM injection. And I also have a whole video on scruffing a cat you guys can check out. So here's the spine. I'm gonna go 2 fingertips over. I'm gonna eyeball it and hold on to the cat a little bit too. Inject it and pull out. Good kitty, you did great. All right guys, thank you for watching this video on how to give an IM injection to your cat or your dog. All the kitty and dog actors were so cooperative and so good for their injections today, and you guys got to see how it happens in real life. So it's not easy. If you need your veterinarian to help you, which most people do, call your vet and discuss with them how you want to give your pets their joint injections. If you guys like the Summit, the chondroitin sulfate product, I'm gonna put the link in my bio and you guys can click on that to order it for your pets and then consult with your veterinarian how you're gonna administer it. So like always, hit that subscribe button and hit the bell to get notifications for when I post more videos. It's okay, little kitty.